So thank you for joining us. Thank you for everyone that has been involved in organizing this side event. Thank you for the Finland and Belgium for co-sponsoring this event, and to all of you. So we have the speakers announced, so we'll be really brief. Maria Ventura, Iga Jerzowska, Susanna Ronconi, and Danilo Pallotta for the MCDDA. I am from FEDA in Brussels. Our organizations and my organizations are all part of the Civil Society Forum on Drugs at the European level, and also the Vienna NGO Committee. So for us, of course, civil society is a critical partner in policy making. Decision makers must work with civil society in developing, implementing, and evaluating policies. I recommend also for you to have a look at the CSFD, the Civil Society Forum on Drugs.eu website, where you will find interesting position papers, and also on specific topics, but also on how to work, how to collaborate, how to implement works with civil society at the national level. So the session is only 50 minutes, so I won't say more about it, and give the floor first to Iga, as we will now have really concrete examples of how civil society can work and help governments in monitoring and evaluating drug policies.
Yeah, thank you very much, Stefan, and thank you everyone for being here. My presentation will be rather general to kind of provide some remarks and introduction of how, as Stefan said already, how data collection monitoring can work. I will focus on our experiences as a Correlation European Harm Reduction Network that we gather through our annual monitoring efforts. First of all, for those of you who may not know who we are, Correlation is a network established in 2004 in Amsterdam. It's hosted by the Regenboog Group, which is a low threshold service provider in Amsterdam and area. And we are a network of more than 360 now organizations and individuals working in harm reduction. And our monitoring started in 2018 with development of a framework that includes our network of focal points, so service provider, low threshold service providers with good connections at the national and local level and good knowledge about the situation in their cities. We collect data at the city level, and the main three main or kind of core topics that we cover are essential harm reduction services, HIV responses among people who use drugs, and new drug trends. We at the moment have 42 focal points, and on average 35 participate every year in the monitoring that consists of survey, focus groups, interviews, and so on. So I would just like to address basically the aspects in how data collected by civil society is different than those collected by the national agencies or international organizations. So first of all, civil society organizations are independent from the governments, from business, and so on. The relevance of it is that with these monitoring efforts that we as Correlation, for example, we try to keep governments accountable, keep donors accountable for implementing policies that they declare to implement. The second main aspect is the partnership. So, of course, there is this independence, but we still work in close cooperations with policymakers, contributing with our information to the policy making processes, policy implementation processes, policy evaluation processes. And third of all, we connect. So there is a connection that we establish between service providers and decision makers, but also, most importantly, I would say, between the communities of people who use drugs and policymakers, because this is one of our core activities and goals, to provide this connection between the communities and policy making. So the data collected by correlation, as I said already, it is collected at city level, contrary to a lot of data that is collected by the governments, that is the national level normally, and it reflects service providers' experiences. Okay, so it is direct data provision. It doesn't go through, I don't know, several levels of intermediaries, aggregation, and so on. And what it means, finally, so we have service providers with hands-on experience. We have service providers who are characterized by deep compassion towards the communities that they serve. And we have service providers who are knowledgeable about the needs of the communities that they serve. And these three key aspects contribute to this uniqueness of the data that we collect. And this uniqueness is manifested in the more qualitative and in-depth character of the data that we have. So it's not numerical, it's more qualitative. It is contextualized, and I think this is extremely important because we ask our focal points, our service providers, for example, to what extent services in your city are able to deliver particular services to the communities. So it's not we have 3 services, we have the extent which provides this context regarding the needs of people who use drugs. This data is reliable because there is a high level of trust established between us and our focal points, but also between the communities and the service providers in low threshold harm reduction services. This data is a real-time data because we see it from service providers at all times, basically. It's not data that is collected at one point in time, for example, 2 years ago, but it's a real-time data and it's also timely. So we report within half a year up until 1 year on a certain situation. So there is less delay than in more bureaucratic contexts. And this all makes our information, I think, complementary to what is collected. So it's not, we don't see it as competing with the data collected by, for example, EMCDDA or the governments. We see it as complementary. Yes, and I think that would be it from me regarding this general context. Thank you very much. Regarding one more thing, sorry, regarding we have leaflets with our newest publications. I think, yes, they were distributed. So you can see the publications that we released from December up until today, all on this leaflet via the QR codes. Thank you.
We'll take the questions afterwards, so I'll directly give the floor to Mireia Ventura.
Yes, in a second. Oh no.
No, this is mine.
Yes. This is yours. Here we go.
Great. So thank you for the invitation and thank you for joining us. My goal today is trying to explain why drug checking services, which is a tool that we were using with harm reduction for a lot of years, is now a very useful monitoring tool. Because these drug checking services are directly tailored to people who are using drugs and adapted to their needs. But also since 2011, thanks to a big European project that we made with Stefan, we have a big network with all the drug checking services that are collecting data in Europe, and at this moment we have 25 members, and we are using different techniques and different approaches, but finally the goal is exactly the same. And one of the differences that we have from other ways of monitoring is that we have the trust of people. The data that they are sending to us, the samples, are based on trust, the relationship that we have with them, because they totally trust with the type of intervention that we are giving in these interventions, but also at the same time they want to feel which is how is the market and which is the composition of their drugs. They are very concerned about this. They are totally aware that this is an illegal wall, and then we can have this type of information. For example, this is one of the reports that we we made recently in the information that we gave with the help of correlation. And in these reports, we can show, for example, the situation of the MDMA in terms of all the adulteration. No? For example, in this graph, we can see perfectly that if we compare the samples that are arriving with the content, we can see that most of samples, the vast majority, is MDMA without adulteration, that this is this light color. And if we compare with cocaine, we can see that is just the opposite, that the substances are mainly adulterated, and mainly what we can see is that the cocaine have several adulterants. So this is thanks also to this expectation that we have from users, and that they explain that this sample is cocaine and that they want to know exactly the content. So we are not only detecting substances, we can also figure out how the market is composed. And this is thanks to this connection that we have with people, these efforts that we have with them, trying to adapt as much as we can the drug checking services to their needs and to the market. And this is why also we trust that the results that we are giving are relevant for them and are useful for them. This is one of the examples of one of the articles that we made with the TEDdy network about the behavior and the actions that they take after our drug checking services. This is one of the examples of a big queue for a drug checking service in one festival in Portugal. This queue was in between 2 or 3 hours, just at 40 degrees, so they are really willing to test with us. And the most important thing is that when they have a substance that is not the expected substance, the vast majority, so the intention is 93%, but also when we are asking for the behavior, we can see perfectly that they are not only saying that they are not going to use this substance, that also they are doing this. So the type of information that we are sending and that we are giving to them make them and help them to take some decisions. This is another example of a big festival where we were detecting big high dosage pills. And for example, the organizer, what he was telling, this was the first time that they had drug checking services at their festival, is that only to know the drugs that are circulating there, it gives this reassured feeling. But also the person who was in charge of the emergency department, what was telling is once these warnings were launched, the emergency departments were empty. Because when you are giving this type of information, people are adapted to this information, and then we detect several pills that were high dose, but finally the emergencies were not one. And then this is also a process that we have very well worked, the warning system. So every warning that we are preparing, we are always thinking and evaluating the risk of the substance. So we have different levels with the warnings, and when we have the red alerts, that means that this is the most dangerous possibility that we can have. And we also select where and who will receive this information. So if the warning is not very dangerous, we are only giving to the person and trying that this information circulates between the friends. But when we are detecting possible high potent substances, such as this example, then these are red warnings, and these warnings are going directly, massively, to reach people. We have several examples that when we reach this high population, the death stopped. This, for example, is another example of a recent detection of nitazines in Ireland. The warnings were launched, but until when they contact the government, contact with the people who are providing information to the harm reduction services, were able to transmit and to adapt this warning, as we can see here with this type of design. And only when this type of alert was launched, the death stopped. So finally, it's very important how you are giving this information and how you are reaching your target group. And also we need to go further, because we are now facing a very difficult situation in terms of these new synthetic drugs, and a lot of different things that we are detecting from the field that will help us to understand how drug use will be in the next years. But also we are evaluating all the warnings that we are launching, and we are evaluating the message that we are giving and the type of results and the type of answers, because we don't only want to work at the short term, we also want to work at mid and long term. and that means that we need to understand also which type of message are good for our target group. In this sense, I would recommend the publication that we made recently with the MCDA, that was last October, and that we are talking about these health risk communication strategies that we are using at drug checking services based on the experience and on all the communication and connection that we have with our target group. So, as a conclusions, I would like to highlight that these drug checking services are very good tools for monitoring drug markets, mainly because we have this expectation from the people who are delivering the samples. Also that they are very valuable tools for public health, because we can reach these hard-to-reach communities. It's very difficult sometimes to contact with people who are using drugs if you are not giving them to them something that is interesting. We need to think that for these people it's not working, the general prevention, because they are using drugs, so we need to go for more specific information. And then also these drug checking services are very respected by our target group, so this is also very important because we have big impact on these communities. And one of the biggest examples are warnings, because are extremely useful to remove these toxic products, because once we launch these warnings, the intoxications or even the death stop. And then it's very important to understand the current situation that we are facing. We are in a very critical moment, and we need to effectively prevent the future and all the issues that can come from these new synthetic drugs. And then drug checking services also, we need to adapt to all the reality, and we need to know exactly which is the situation to help to develop the message and to work for the next prevention. Thank you.
Will give us another concrete example, rather from Italy.
Okay, thank you. And I want to share with you our 15 years experience with the Libro Bianco in Italian and white paper, or if you want a shadow report, that we present every year on the 26th of June in the press room of our parliament as a counter voice of the governmental yearly report on drugs. We started with this initiative, and I want to say also that the White Book is also in the framework of the Support Don't Punish campaign that support us in the publication of the White Book. We started with this experience in 2009, just looking at the data that the government produced every year about the new law approved in 2006, which was a really counter-reform, a very punitive and repressive drug law. And of course, every year the government published their data on the implementation of this law. And at the time of the third report, we realized that the data that the government published, saying that this law did work, was a success. From our perspective, this data showed the disastrous impact of the new law on people who use drug and home community. So we realized that we have the possibility and also the necessity to reinterpret this data. So the characteristic of this report is not to find or invent a new source, but to make a different analysis and to go inside and behind the numbers that the government produced. So we worked for 5 years, every year, monitoring and reinterpreting this data. And in 2014, we were successful because this law was abrogated by the High Court. not only thanks to us, but also thanks to us. And then we realized that this kind of monitoring could be useful. And so we decided to go on, because after the abrogation of this law, we came back to the previous law that is anyway a repressive law. So now we are always trying to promote a reform of this previous law too. But this experience with the High Court told us something. First of all, that showing evidence of the impact of unexpected or unintentional outcomes of the law is useful in promoting advocacy action. So showing evidence is useful. We learn also that process data are not enough when presented in a bureaucratic way. So numbers are not neutral. Numbers need to be interpreted from different perspectives. We realize that the plurality of analysis approaches are important. We made a collaboration and partnership with different civil society organizations. First of all, with the organization working in prison sector. And we started only with two partners, so my organization Fuoriluogo and Antigone, which is the most important Italian NGO working on prison. And nowadays we are 9 civil society organizations, because we wanted to involve, many other perspective and culture on drugs. And then we realized that an active protagonism of all the actors involved is absolutely important to produce the assessment of the drug law. So I go quickly there, because we all of us know that numbers are not neutral, are not objective. Numbers need to be seen in their context to have a meaning, and numbers must be queried, compared, and integrated. And that is what we do with this our work. Only few examples of what we stress and evidence with our work. That is what the government reports forget to say about their own data. For instance, we stress that comparing data on criminalization and repression and the trend on the use of drug and on the development of illegal market, no decrease happened in the use and in the market, notwithstanding a very repressive law. We stress, for instance, that our prisons are overcrowded of people, but are overcrowded of small fishes. So this law affects not great traffickers that are only the 3% of all the prison population, but the small fish, the small dealer that often are users themselves. And in Italy, they are 1/3 of the total prison population. Then, for instance, if the minor dealer are the most affected from a penal sanction, it means that many people who use drugs are inside prison, because many more small dealers are users themselves. Or, for instance, another interesting numbers deals with the trials and with the attitude of a judge towards the people who make drug crimes. We discovered that 7 out of 10 drug trials end with the sentences, while only 1 out and with the sentences for all other crimes. This is the evidence of a very repressive attitude of the jazz, for instance. And another thing important deals with administrative sanction that affect people who use drug in a very hard way and have a great and negative influence on their lives. And the most important, that administrative sanction deals with the young people. The young adults are more than 1/3 of people who receive an administrative sanction, and the great part, 75%, are cannabis users. So this is only a few examples, but every year the White Book presents a lot of consideration like that. And so our question is, can we draw some evident conclusion about current drug policies starting from this picture? And our answer is yes, we can draw some conclusion in a reform perspective. This is only to remind that in the second part of the White Book, every year we focus on some specific topics that is on the agenda of the debate, national debate on drugs, and we give also voice to local, for instance, local research, local report, so that to wider the source of knowledge. To conclude, we think that it is important to go on because around the publication of this shadow report, there is now a very strong network of organization, and it is a useful tool for advocacy action for many movement. Of course, there are some challenges. The most important challenge deals with a problem that all of us know very well, and that is the dialogue between policy makers and evidence. So we know that we adopt a very rational, reasonable language, but it's not always clear if this language is understandable by the policymaker. But we think that we have to continue and to insist because evidence and counter evidence is an important tool we have, and we must use it in the best way. Thank you.
Thank you very much for these 3 examples of what civil society can do, and also in terms of monitoring, and then also how these results can be used in different ways. There are also, of course, many other examples. These were the 3 ones for today. And now I will give the floor to Danilo from the MCDDA, as it is also, of course, really interesting for us to know from a European agency what can be the perspective in relation with collaborating with civil society, and also what it has been maybe so far and what it could be in the future in the next years.
Thank you very much for this invitation, Iga, and you. And it is a pleasure to talk about data collection and monitoring from a civil society perspective at this moment, at this CND. Because the wise EU legislator and some of the policymakers are here in this room decided to change the mandate of the agency. On the 2nd of July, we will be moving from a monitoring center, from an observatory, to a fully fledged drug agency. We will be called the UDA, or UDA, European Union Drugs Agency. And to show you the difference between before and after, before, the current regulation mentioned only one civil society, only once, and says NGOs, collaborate with NGOs and the others. The new one mentioned civil society 20 times, and there is even an article about it. So the legislator wants us to maintain cooperation with relevant civil society organizations active in the field covered by the regulation. However, if you read the document, this maintain is not such a maintain. If you read all the article, is to establish a steady, systematic collaboration to consult, exchange information, and pull knowledge from civil society. So this is not maintained, this is much more. Also because it requires the UDA to have a single contact point under the directorate, under the authority of the director, for a sort of civil society liaison officer in the agency, and also to have a platform where to exchange information. There is a very important condition, for us is absolutely clear, and is in the recital 7, and says that this collaboration should be understood to maximize efficiency in monitoring, assessing, and responding to drug phenomenon. I think this is a key element which will filter also the kind of collaboration that we will have, also the kind of civil society agencies we will be in dialogue to, because everything must respond to this part. We need to maximize what we do. As in any relationship, if we are together, we should be better than when we were separated. So this marriage means that the agency needs to be more performant and needs to be better equipped to monitor, respond, and evaluate the phenomenon. It's not that until now we haven't done it. As you can see, we are working with the TEDdy project, absolutely key, timely information, which is integrating the more solid, robust, but sometimes low information. Together, they can really give and it's not only this, we have the ESCAPE project, which is about analyzing the syringe residues. So we understand which kind of drugs are mixed together in the syringes. And this comes from NGOs in the floor, in the ground. So this is absolutely relevant for us. We have to integrate this in the new system. So we will start working on that from July. So it's possible that by the end of the year, next year, we need to have structures in order to understand how we want to collaborate. At the moment, there are many questions they are working with. Who is civil society? Because the Commission has solved this question, but for their own purposes. The Commission, as the Civil Society Forum on Drugs, Commission is a policy body. We are a technical agency. Therefore, we have to understand what is civil society for us. The legislator here came in to help a little. He said civil society organization working in the field covered by regulation, because that's a lot. But then he said affected community by drugs and crime and the drug issue, and then people use drugs. And this is really a revolution, because as you know, this has not been really much done until now. We have to find systematic ways to also integrate this population in maximizing what we do. So as you can imagine, it's not very easy. We need to solve questions like how we do that. Civil society could be huge. The legislator does not stop at the EU, because he said national, regional, and international. And therefore, we need to understand what's the threshold. Is the African civil society on drugs relevant for us? Is the Canadian civil society relevant for us? There are all questions that, of course, impact also in the efforts we have to play, in the resources we have to deploy. So it's very exciting, very difficult. What we know very well, we are not a political agent. We will never be a political agent until a regulation change again. And therefore, all sorts of civil society working in the political area, maybe they will find less attractive to work with us. And also because we in the civil society, we need to, and we are very clear, we have to understand that we are moving in a field that does not really belong institutionally to us. Civil society might have another view, but it belongs to member states as policy initiatives. So we are there to help, to support, to promote, to improve, but not to make or to do on their behalf. And this is very, very clear. And probably the success of the MCDA in the last 25 years is because we had this very clear from the beginning, and we never stepped out of our role. Therefore, it's very exciting. At the moment, I am in charge of transmitting this until my director will finally give this task to someone, to a lucky one or a lucky lady or man. And this probably will be communicated via our website, but certainly people working in civil society organization in the field of drugs in Europe and around will be contacted by us. We want to have a transparent and clear and open conversation and dialogue. At the moment, there are no preclusion, there are no walls. We can listen to anything, we can accept all sorts of proposals. Then we will be asked to decide, and we will present this to our management board according to what the regulation have said. But this, in our little words, is a revolution, and we think it is a needed one, because it's where, a certain part of the world is going, and the EU Drug Agency could not be left out. So very happy about it, but thrilled, but also a bit concerned about the work that if we will be up to the expectations. Thank you for your listening.
Thank you very much for this very clear explanation. Everybody understood this special moment that is happening in the next month for us in Europe, and in defining with you and finding the way that this will happen in the future. Now the floor is for you. I don't know if you want to ask some questions to one of the speakers on specific details of a project, or more largely on collaborating with CSF.
Thank you. Thank you for the presentation. My name is Manu. I'm from Energy Control, but also from Youth Rights, which is part of the Particular Coalition of International Youth Harm Reduction and Drug Policy Reform Organizations. And my question is, how can we use these resources to empower youth-led initiatives for this research, monitoring and evaluation of drug policies for and by young people who use drugs in a way that's sustainable and collaborative, and that really takes full advantage of our unique position to reach young people who use drugs or are affected by drug policies. And thank you.
Does one of you want to respond to this?
Yeah, so I think that there are collaborations in place between organizations like Youth Rights, for example, and organizations that are not exclusively focused on youth. I think that one of the ways of finding these connections and kind of enhancing empowerment would lie in collaborations, perhaps in different kind of longer-term projects, where young people could, on one hand, get some funding for their activities. On the other hand, they could also exchange the knowledge, experience, and skills with other people who are in the field for a little bit longer, maybe. As correlation specifically, we really pay attention to have at least one. We have an advisory committee to our network, and I believe there are eight individuals in the advisory committee, and we really strive to have at least one young person representative of youth in our advisory committee. Now with upcoming elections in the coming weeks, hopefully more. So yeah, I would say that from the top of my head, this could be the venues to address, to achieve what you are hoping for, or aiming for.
Here, we have a small youth-led event on drug use and opioid use by and for young people who use drugs. We want to escalate it as much as we can.
Yeah, don't hesitate to engage and join some of these international networks, or even apply to, if it's European, to be a member of the civil society forum on drugs at the European level. And I guess in a few months there will be the new cycle, and I think it's more or less 45 organization, representative civil society around Europe that are then selected to be in this civil society for the next cycle.
Hi everyone, Miriam Yuji from IDPC, and that's a question for Mireia. So you showed the amazing network that you have on drug checking services in Europe, and I was wondering if this has or has the potential of being expanded globally, especially, for example, in North America and Latin America, where there's an expansion also of these services, and the synthetic drugs market is also quite prominent. So I was kind of wondering if you've already started developing that, or if there's plans to do that.
Yes, thanks, Mary, for the question. As far as I know, they are trying to, and it's mainly a network from South America, also in Central America, but also a network more from the part of the north. But yeah, finally, what we were bringing in the beginning is also structures thanks to a project. So what it makes a difference for TED is that we have a common database, that this database is being fed by all the data of the members, and we have a data manager who is a person who is harmonizing this database in the sense that for the partners, for the members of TEDI, is not a lot of work also. It's not work for them. It's only to send their own database, and we are harmonizing it to the TEDI template. So this is also sometimes difficult to manage because every country has their own language and their own way of functioning, their own indicators or their own way of monitoring. So to try to share the same way of monitoring is one first step. That this is thing that what they are trying to do. But then to reach these harmonized databases, this is not easy. So at least we will need some budget from the beginning, or so of course we can share, because you can do it with not a lot of money. But you need a person who is harmonizing, because if not, you cannot ask partners regularly, because this is also one of the most important things, to be on time with data. So it makes sense when you have the data from the previous 6 months, but not from the previous 2 years, because you don't have time to update it all the time.
Benjamin and Catherine.
Thank you for the visit. I'm Benjamin from the Fédération Addiction, which is a network of addiction professionals in France. And I have a question more for Ilya and Susanna. Once you've published the report, what do you do in terms of dissemination and communication so it has an impact on public policy? Do you have methods? How do you do? And for the correlation report, I ask also for myself, like, we are the focal point for France, maybe we don't do enough to disseminate what's in it. So.
Yeah, so we do have executive summaries in several languages, first of all. I think it's 8 or 10 languages, 10 languages this year. I'm not sure if all of them are ready already, I think. So this is one of the channels of dissemination, just to aid. I think French is also included. Then we organize webinars in the beginning of the year to discuss these results and their consequences for advocacy, for policymaking. We do attend conferences with these results, and well, this question that you are asking has been actually a question that our members of Focal Points have been asking also in the recent years. So in this year's work plan, if everything goes according to the plan, we will also have are part of a project that is dedicated to providing advocacy, support, guidance, and training to selected organizations to equip them in skills that would allow them to use these publications more at the local or national level in policy making. It is definitely a challenge to connect the data that we collected, the report that we publish, to very tangible actions on the ground. We are getting there, but it's just the beginning of the way.
With regard with our report, first of all, we try to make a good use of our network, so we have collaboration at the different levels, for instance, for trade unions, of people working in the public sector, or lawyers, or judge association, and every kind of network at social civil society level. So we spread our publication, but also organize many events, different events in different contexts, and this is very effective. And it is effective also, what I said before, to present ourselves as the counter voice of the government, starting from the same data. This is very strong, I think, and effective. And then we, on the other side, send a copy every year of the book to each parliament members, because of course this is a target very important for us, because the final goal for us is to promote drug law reform, a drug policy reform. And then, of course, all the web and social media channels. But it's very important to go all over the country in presence and to meet, different groups and different contexts in present. So I think it's effective.
Yeah. Hi, my name is Catherine Schiff, Correlation European Harm Reduction Network. I just wanted to follow up on what you were saying. I think the follow-up of preparing all these kind of reports is extremely important, and also probably for civil society the most difficult one, because you can collect all kind of data and you can create potential evidence for development, but if you do not reach policymakers or politicians, you will always stop. So I think this new advocacy mentorship program, what we want to develop, should be really focusing also on a very specific situation in the country or at the city level, and to see what kind of things we can push for it. I mean, we can prepare policy papers at local level, but this alone will not help, so probably it is needed, to reach out, and we can look into ways how to do this. But we also need to realize that most of our focal points and members are organizations, service providers, who do not have advocacy in their main pocket of activity. So this is also the kind of limitation we are seeing.
And capacity.
Yeah, and the capacities, yeah.
This is one of the biggest problems.
Yes. But one more thing in response to what you said. I think something like the monitoring, there are many good practices, or there's a lot of experience now. I think we have developed it after working for it for a long time, and I think this kind of the balance between doing research with people who are not necessarily researchers can be a really good thing, and I think we should make use of the networks, also from Daily Network and the other networks, on how to do it. And I think that's great.
We do have people who are instruments that are researchers who would love to.
So maybe one last quick question. The lights were flickering before, so I think it's time to wrap up. Thank you very much for your attention.
I would just say one word. We are organizing with Correlation in December in Warsaw European Harm Reduction Conference this year. And Manu, then we are more than welcome to apply with abstracts. We also have a thematic issue. I already talked to Rebecca about it. Of Harm Reduction Journal, and we are focusing on community submissions. We absolutely will try to provide mentorship if necessary and support on the way if it is required. So submission on the youth harm reduction, youth-related issues are also very, very welcome. We can discuss it at some point if you are interested.
Thank you so much.
Yeah, thanks. Thanks for being here.